All right, good afternoon, everyone. It is now noon and we're going to go ahead and get started. We will be recording today's webinar, so you will be able to check it out later. I am Helen Hockey. I'm the Executive Director of the Pennsylvania Coalition for Oral Health, and we are so very glad that you have joined us today. We're really happy to offer these brief updates on the coalition work twice a year. So we do them in June and we do them in December. As always, as I mentioned, the meeting is going to be recorded. It will be on our YouTube channel, so you're able to share the link with others after today. A little bit of housekeeping as we get started. All lines have been muted by us to keep the background noise to a minimum. You can type any questions that you have at any time into the Q&A box. It should be at the bottom of your screen. And we're going to, maybe grab some of the questions as they come in, but if not, we'll make sure that we have some time at the end to address anything that's come in during the time of the webinar. So for any of you who have joined by phone and are unable to see the slides right now, I would just encourage you to go back and review the video at a later time. We'll send the link out for the presentation directly to everyone who is registered for today. And the slides will come as a PDF so that you're able to click on any of the active links that we have built into the slides. So for those of you who have been around a while, our coalition priorities should look pretty familiar to you. We've got our main focus areas listed here. The coalition really does work a ton on workforce development, oral health policy, community water fluoridation, and then really thinking about some of our under-resourced populations and how we can bring a little bit more of an equity lens to some folks accessing dental care. So as we talk a little bit today and move forward with our discussion of the work we've been doing in 2023, I just want to point out that some of the items that we're going to talk about are work that's done more internally by PCOH staff and board, but almost all of our work is really collaborative. So we work to improve oral health in the state. We want you all to know the most recent updates for all the work going on. But we also are kind of leaning on you to let us know if you hear of something that we should know about. You should tell us about it. We'd love to make sure we're making good connections across the state. And likewise, if we talk about something that really interests you and you want to get involved, we would love your help. So sometimes that's just sharing our resources or checking in with a staff member to tell us what you're working on, or you can actively join a task force or a work group. So if you're interested in learning more about anything that we touch on today, and sometimes that's just us sharing who that lead organization is, just ask, and we are more than happy to share. So when you attend a PCOH event or you reach out to us about an issue or a concern, these are the folks you're going to be talking to. So just wanted to share our staffing changes. We've had some new staff come on in the last 6 to 8 months. So I want to make sure that everybody knows who we all are. And we've linked the individual emails in for all of our staff onto the slides. So you can grab and email any of us. I will say, I think most of you may be familiar with Amy and I. We've been around a little bit, but I want to do a formal welcome more to our staff that have joined in the last year, which would include Nicole, Leah, and Allison. And the work that they're doing has been great. We've been able to really grow our reach a lot in the last 6 months, and that's largely due to the support of those lovely ladies. So I should also mention PCOH relies on a number of students each year to help support our work. So if you know of any students that are looking for internships or school projects, definitely feel free to connect us because we do stretch our capacity through the use of students and interns as well. Next up, to start us off this afternoon, I'm going to invite our immediate past board chair, Ms. Lisa Davis, to say a few words of welcome to everyone. Lisa.
Thanks, Helen. Hi, everyone. Thank you so much for spending the next hour with PCOH. I'm Lisa Davis, and I'm with the Pennsylvania Office of Oral Health. But much more importantly, for this webinar, I'm the immediate past chair of the Board of Directors. And Jessica Rhodes, who is the current board chair, is out of state today. So she asked me if I would be willing to provide some welcome comments, which I'm so glad to do. I have to say that in all the years that I've been involved with the Pennsylvania Coalition for Oral Health, this past year has been one of extraordinary gains for productivity, activities, and also change in terms of the number of staff, which you've just seen. And I can say that this organization moves at quite a speed. There are a number of initiatives that PCOH is involved in, so much that you will be hearing about in terms of data and reports and advocacy work. So we're so looking forward, I think, to hearing not only about what has happened in the last 6 months, but what will be happening in the next 6 months. And PCOH is also implementing its first formal strategic plan, which went live on January 1st. So there's a great deal in store for PCOH. So Helen, I'll turn things back over to you, and thank you so much. And thanks to all of you for spending time with us.
Thank you, Lisa. PCOH, as you can imagine, is very lucky to have some really wonderfully dedicated and super passionate board members in our organization. So they deserve a lot of credit for the time they put in. So lastly, before we get into the work we're doing this year, I wanted to just recognize how fortunate we are to have a lot of support from our corporate and community funders. For those of you who've been following us for a while, you've probably noticed that we're quickly growing and adding staff and new programs. And it's largely due to an amazing list of funders that we just can't thank enough. As some of you know, PCOH is a registered 501c3 nonprofit, and about 84% of our funds in 2022 went directly to our programs and program administration. So some of that is work that we do ourselves, some of it is work through our partners and subcontractors. And though many of our programs do use federal and community grants, we also rely heavily on the corporate and organizational and individual funders to kind of keep us moving on a variety of projects. So you can always visit and see our full list of funders in our impact report that we publish every year. We'd encourage you to visit our website, and you can click directly on our funders and learn more about them. But we really just have to thank everyone who's contributed to our work, both for this year, which, as you can see, is a lot of different organizations, and to all of our past donors who've really helped us build up to like the strength that we are today. So if you're interested in learning more at any point about sponsorships or making personal donations, we're always happy to talk about that at your convenience. So as we get into some of the work, we wanted to start with just, this is the one slide of background information for folks who maybe need to catch up a little bit on what the coalition does. Wanted to make sure that you had a place where you could visit all the appropriate links to get to all the information you might need about PCOH. So we obviously our website is always changing, trying to improve that at all times, keeping it up to date with a lot of resources and materials. We do maintain an online calendar, which has state meetings, state conferences, sometimes things across the US. Anything that we feel like oral health stakeholders would be interested in, we're going to maintain on that calendar. So it's a great place to keep bookmarked. Our annual reports and impact reports are also housed on the website. So you can go back through the last few years and actually see the projects we worked on every year. They're not anything crazy, 10 to 20 pages. So something you can flip through, lots of pictures, but gives you a great idea of some of the work we've done in the past, as well as all of our past newsletters, our newsletter sign up. That will kind of keep you posted. We do weekly newsletters that do help folks kind of stay in touch and see what's kind of happening in our world and what we're seeing come across our emails. And then, of course, any past webinars. So our YouTube channel houses a lot of courses and different recordings and updates we've done. So the YouTube channel is a great place to check some of those out. So we've got live links to all of our social media as well. And I wanted to just briefly mention we have two bigger events coming up in the remainder of this year. As many of you know, we hold a biennial summit, meaning every 2 years, that takes place in November in Harrisburg. And 2023 is a year for a summit, which is our favorite type of year. It means that we all get together, usually have about 120, 130 folks in the room. We get together for a few days and really learn from each other, see what's happening in the world of oral health, and also hopefully leave with some new ideas and, having a little bit of a renewed energy to go out there and get the work done. So we're really, really excited. Something we'll talk a little bit about this at the end, but I did want to mention this year we're having a pre-conference session on November 15th, which will include a poverty simulation. So we're hoping that all of our attendees will come in on Wednesday and participate in that poverty simulation, which is a great way to really open eyes and think more about sort of the problems that folks have in accessing dental care and a lot of other resources. And then, of course, our December 8th update will be similar to today with a year-end webinar. Just a brief pause to mention we have a few work groups that are active, working all the time, meeting regularly, either monthly or quarterly. And if you have any interest in these areas, please definitely reach out. We work on a lot of family oral health, community water fluoridation, workforce, school sealant programs, and Medicaid. So those are the groups that meet regularly and help to accomplish a lot of work in our state. So what we're going to talk about mostly today is walk through a few of our priorities, give you a little bit of information on sort of the background, and then the work that's been accomplished during the first half of this year, with probably a little bit of information of what we're going to be working on moving forward throughout the rest of the year. So again, reminder, if there's any questions, please just dump them into the Q&A at any point. Some of the stuff we may connect back to later, but we'll make sure that we address any of those at the end of the webinar if needed. So we're going to start with a little bit of community water fluoridation. And what I did today with these slides was I wanted to really just give a quick 5-second background, right? So if you're new and you've never talked about community water fluoridation, what are the key points that you need to know to kind of get a little bit more grounded in the subject? And so you'll see here, it's been a wonderful public health intervention that's been used for more than 75 years. Why fluoride is so good and how it makes the teeth stronger. And then one of the things that we really like to point out as a very important talking point with community water fluoridation is that it reaches everyone, in particular, those individuals that might not have access to a regular physician or dental provider, or may not be able to afford toothpaste or buy fluoride toothpaste. It's something that can reach everyone by simply turning on the tap. So we really want to make sure that we're reflecting the ideas of water fluoridation being available to everyone. It doesn't matter. We see a lot of disparities in access to dental care when we start looking at those who are served by certain insurances, those who are uninsured, low income, high income, different, those with disabilities, different populations where we've seen some inequitable access. Water fluoridation is great because it's for everyone. And even if you're not necessarily drinking the tap water, you're going to cook with it, or you're going to go to restaurants that use it. And you get that benefit even without thinking about it. So, and of course, a lot of major organizations support it. There have been thousands and thousands of studies done to show that community water fluoridation is safe. And we really have had it as a priority of ours for many, many years, and continue to fight for that. So we're going to talk a little bit about what we've been working on there. So one of the things, and this is a little bit of newer information that we have not really put out there a ton yet, is that we realize that the folks that are the most valuable when it comes to water fluoridation are our water operators. So many of you probably turn on your faucet and you get your water, and you maybe don't necessarily think about the amount of work that goes in to getting that water to your tap. And so many community water fluoridation advocates will talk about water systems and water operators and the roles that they play. And what we really wanted to do this year was to put out a little bit of a thank you campaign, so that we can make sure that our water operators know that we value the work that they do. And that especially for those systems that do choose to adjust the fluoride level in the water, that they understand it's appreciated. Because I don't know about you guys, but everyone likes to be appreciated. So me included. And, so there are some links there. We have a flyer with some suggested messaging. We have a link there where it says request materials, where you can actually get little note cards. We will help you get address labels for the water systems, identify who to be sending those things to. But when we designed this campaign, what we really wanted to see happen was for groups like, say, maybe a dental hygiene program, or a local Girl Scout association or a Rotary Club, to be able to request some materials, have the folks that are in the room with them write a little thank you note to their water system, and then we'll help facilitate getting it out, making sure stamps and the right addresses and all of those things. Because what we'd like to just be able to do is say thank you to our water operators. So that's sort of one of the bigger projects. We just rolled that out a few months ago. So we're hoping that everyone on the call today will take advantage and share that information as well. And then one of the other things we do, of course, is that we provide a lot of information around community water fluoridation. If you've been around a while, you know that we have a map available on our website, so that if you are trying to find out if the water system in your area adjusts the fluoride or not, that you're able to go there, put your address in, and find out right away. We hear that a lot, even, for the folks that are providers on the call. If you're seeing patients and, maybe their home has fluoridated water, but maybe they have a young child who goes to a daycare, that system might not be fluoridated. And so that can influence the decisions of where you're spending your time and the water that you're getting. So we want to make sure everyone has the most up-to-date information on fluoride that's available. We also have a really great resource page. As you can see, I do want to point out that the numbers here are over the last few years, not just since 2023 turned over. But we've had over 7,500 views on our fluoride page. So that's a lot. It's a lot of people interested, and hopefully those resources are helpful to folks. Always happy to talk more about that. One of the other pieces that we're able to do around community water fluoridation is work with the State Department of Health and the Oral Health Program, and a grant that they've been awarded through the CDC to be able to give equipment grants to local water systems who are serving folks with optimally fluoridated water. So just this spring, we were able to finish out 2 awards, one to the Western Berks Water Authority and one to the Wilkinsburg Penn Joint Water Authority. So Pittsburgh area, Eastern area, we kind of got a little bit of everybody there. And really, really helpful to be able to provide that for the folks who are doing this good work. So as you may know, we do visit a lot of water association conferences. There are 4 major water associations in Pennsylvania, and not everyone may be aware of that. But between the 2,000 water systems in the state, there are obviously then thousands of water operators. Some of them are members of these associations. So we want to make sure we have an opportunity to connect with them, to share all of the good news about water fluoridation and how important it is. And then we're currently working on getting a course that's offered through the CDC on fluoridation, approved through the Pennsylvania Department of Environmental Protection, so that water operators could actually take credits that would count towards their certification on water fluoridation. So stay tuned. We're really, really hopeful that we'll get that finished up by the end of this year, because currently the course is available for folks, but the operators in Pennsylvania don't get credit for it. So we want to make sure that we're taking care of them and that they're able to get some credit for that. So we'll move on to a little bit around our Medicaid advocacy. And I know that may seem kind of quick, that we're going to just touch on things quickly. But as I mentioned before, please definitely reach out if you want more information or more details. So we're going to move on a little bit to Medicaid advocacy. Want to talk about why this is so important to us. You know, when we think about how many folks are served through the Medicaid system and how many of them rely on that for their healthcare plan, it's almost a quarter of our population in Pennsylvania. So that's a lot of people. And as many of you know, in 2011, some of the more comprehensive dental benefits for adults were cut. And so now there are services where, you know, things like crowns and root canals and additional sets of dentures after so much time are not really covered any longer. And so kind of why that matters to everyone is that we start to see issues with when those things aren't covered and people can't get the care they need. What we've seen is we've seen a little bit of an increase in, you know, emergency room visits, because if you can't find a provider who can do treatment for you, sometimes that's the only option you have. Which does not help. As many people know, emergency rooms do not provide a lot of dental care. So it can just be a costly, you know, for lack of a better term, waste of time. And it doesn't help anyone get better or healthier. Something else we've seen sort of as an unintended consequence of, you know, the cuts in some of the care is of what's offered is that even our dental students who tend to rely on folks that are served by Medicaid as their patient base for their training, is that, you know, if the services like crowns and root canals aren't covered, the patients coming into their clinics aren't asking for them and can't have them. So we want to make sure that our dental students and dental hygiene students and those who are training to be our dental providers have an adequate base of patients to work with to learn their skills and hone their skills. We also know that folks who have, you know, poor oral health are less employable, have lower self-esteem. We've seen links with, of course, things like substance abuse and recovery. So we want to make sure that everyone has access to a nice, healthy smile, to be free of pain, and to kind of be able to go out there and live their best life. So in our state, we've got a number of managed care organizations who take care of the folks that are enrolled in Medicaid. They go out and set up the provider networks. But looking at some of the data where we're at, and again, these are 2021, 2022 data. We know that less than 1 in 4 of our general dentists are accepting Medicaid. And then when we start to look to see how many are actually billing Medicaid for services, less than 1 in 9 are actually billing a meaningful amount for Medicaid. So just because a dental provider, you know, signs up on the DHS website and says, yes, I'm a Medicaid provider, they also then have to contract with each of the managed care organizations in the state and get credentialed through those processes. So you can sign up on the DHS website, but if you're not signing in and getting credentialed with those MCOs, and then also when you answer the phone saying, yes, we will see you, it doesn't really equate to care being provided. So we're watching those things. And it's one of the reasons that we fight so much to improve adult dental benefits. And then lastly, that bullet point I like to point out, you know, there are statistics that, you know, show kids are up to 13 times more likely to go to the dentist when their parent or caregiver does. So if you think about that, and I always equate it to, you know, if you're someone who doesn't need glasses, you might forget to take your kids to the eye doctor because you don't think like, oh, my 5-year-old might have a vision problem. So it's really, really important to make sure that we get dental care in as a family affair, that kids are kind of learn that system from the beginning. And so how we do that is making sure that adults have adequate access to a dental provider. So what have we been working on? This is some of the most exciting work, I think. Many of you saw we published and shared the fact that our Legislative Budget and Finance Committee, which is an arm of the General Assembly, published a study in January this year, which really did a pretty thorough analysis of some of the problems we have, talked a decent amount about the Medicaid issues and network adequacy issues, and then made some fairly strong recommendations of the systems that we might need to start looking at putting into place, building out options for teledentistry, making sure there's enough providers out there. And so I would encourage you, of course, the study is linked there so you can check it out. So what we did at PCOH was we were able to then turn some of that work and some of our other work into an advocacy day in the spring. So back in April, we had a bunch of folks kind of descend on Harrisburg. We held 25 legislator and staff meetings in one day, in about 5 hours actually, and talked with so many people about oral health. And one of the things I just want to say as an outcome from that work was that people were really interested and really excited to hear about it, which as someone who's been doing this for years, I don't think we've ever had that many people actually interested in what we were talking about. So I think, that was evidenced by their reactions and their passion and how they wanted to hear about what we were doing and why it was important. But then we also saw during that exact same week that we were there were 3 separate dental bills, memos that were introduced, and I have them listed there. The one that primarily deals with the adult Medicaid work was HCO 1569, which is now House Bill 1417. So this is a bill we've been working on and talking with folks about for probably about 4 years now, that just this week was formally introduced and referred over to the Health Committee. So this bill would restore those adult benefits for folks who are enrolled in Medicaid and hopefully help make everybody a lot healthier. So just sort of an FYI, you can go and check the link and see the language of the bill. Essentially, it just restores the benefit structure that we had prior to 2011. And then there's also 2 other mentions here that are current memos sitting in the House. One is a teledentistry bill, and one is the Dentist and Dental Hygienist Licensure Compact. So if you don't know much about these, the teledentistry bill simply defines what teledentistry is and codifies it in the state so that the State Board of Dentistry can say, here's what teledentistry is. Yes, insurance should pay for it, those kinds of things. There is a lot of teledentistry already happening in our state. So, you don't have to have a bill to say that, but it's nice to have it on paper and to be able to refer to it. It makes people a lot more confident in what they're doing. And so we think it's important to have that bill move on through. And then the compact bill, if you guys aren't aware about this, really was brought forth a year or 2 ago at a national level through the Department of Defense. And what they were seeking to do, many states have done compacts for a lot of other positions, but they wanted to see license portability between states so that, say a military family moves from Ohio to Pennsylvania, if a member of that family is a dental professional, it may take 6 months, 8 months, 10 months to get their license in that new state. And, for a military family, they may move after 12 months. And it's just, it really is a burden for folks, especially those who are moving across state lines quite frequently. So this would just simply recognize other states' licenses if a state would choose to participate. So a really interesting bill that we're hoping will get some traction. And then the other piece I just wanted to talk about, not legislatively, when we talk about Medicaid advocacy, is that we've seen a lot of really great progress from the Department of Human Services. I just want to say they're listening, and I want everybody to be aware of that. They're really trying to improve the program and listen to what folks are needing. So there are 2 bulletins that I linked there that the first kind of defined a little bit more information around teledentistry and some additional preventive coverages that are now covered by Medicaid. And then we were really happy to see an additional bulletin come out last fall that added some additional service codes for the Medicaid fee schedule. And one of those codes, the D4346, should have written that one down, but I'm 99% sure, it is actually a periodontal code, a gum disease code. So something that hasn't been covered in the last 10 years. It's a newer code that basically covers a little bit more of a severe traditional cleaning. So when you have, most folks have just coverage for basic cleanings, but if they have any gum disease, that's not always the best choice of treatment for them. So this covers something that's just a little bit more severe, and will help a lot of folks out. It helps our providers out too. because there's nothing worse than being a provider who knows a patient needs something, but you can't give it to them because it's not covered by their insurance. So we're really just happy and grateful that the Department of Human Services is adding things on. And we've also seen that Governor Shapiro had a little bit of additional money in the budget, looking at adding an increase to the dental fee schedule. And some of you may have seen the news that, when in January, there was a backlog of, and this is across the healthcare field, but 35,000 different providers that were backlogged for getting their credentialing through the state. And they actually cleared that all out in the first 5 months, which is amazing. So now when we hear about folks who say, oh, I'd like to be a Medicaid provider, but the paperwork is so long and it takes forever. Well, that's hopefully not going to be a problem, at least not as much anymore. They're really, really trying to improve that system. And I think that'll make it easier for everyone, both the providers and the patients. And we're continue to also investigate a couple other things around Medicaid billing. We'd love to see school districts being able to bill Medicaid for services that are offered. And we also want to make sure, many of you know that there were some folks who sort of pulled back from being a Medicaid provider during COVID, post-COVID, during that time. And what has happened is that our safety net clinics, like our federally qualified health centers and our rural health clinics and our free clinics, have all really had to take on additional burden then. I'm thinking of a county in our state where, every provider except the FQHC decided to stop taking Medicaid in the last 2 years. So now the FQHC has a waiting list of 3,000 people. And so we want to make sure that they're supported. If they're providing, 90% of our Medicaid members with care, we need to make sure they're being supported. So we could definitely continue to advocate with all of our organizations and friends on that work. So we'll go ahead and move on to the next subject, just to make sure we have lots of time to get through everything. Wanted to touch on workforce a little bit and make sure that we were kind of talking. That's a pretty hot topic. I'm not sure, if your work touches that or not, but we've definitely realized that we're losing providers. And we need to do something about it. So some of the reports that we've mentioned and that we've linked in some of these slides, we know that our provider numbers are going down. We know that kind of where the providers are located has kind of been a disproportionate situation. So we've got rural, disparities. We've got a lot of dental health professional shortage areas. That's a number that is tracked for all states across the country. And it's something that we hope to see improvements in, right? So if you have so many shortage areas in your state, you would hope that over time you would have less and less or fewer of those. Unfortunately, in Pennsylvania, we've really been sort of stagnant in that. We've been sitting between 150 and 165 for at least probably the last 10 years. But what that means is with having 163 shortage areas, we've got almost 2 million Pennsylvanians that don't have care. And so we want to make sure that, we kind of stop the bleeding with that. We know the number of dentists is expected to continue trending downward until 2030. So that's still many years away. And so what I have sort of been telling people, and I hope this doesn't come across too negatively, is that, if it seems bad now, 10 years from now, it's going to be even worse. 5 years from now, it's going to be even worse. So we really want to make sure we're acknowledging workforce issues and taking steps now to try and fix those things. Let me see here. So when we have fewer providers, what does that mean? We were able to, many of you probably saw our first workforce report that came out last July. And we were able to do a secret shopper survey to sort of reach out and find out what's actually happening out in the real world. So if you call 1,200 different dental offices in the state and ask for an appointment, you learn some things. And what we found out was that we've got an average of 55 days for someone to get a new patient visit at a new dental office. which is pretty long, nearly 2 months just to have that initial visit done. Is pretty long. And then when we start to look at, as I mentioned, those safety net clinics, the folks that are maybe seeing some of the population served by Medicaid or the uninsured, that number of 55 days wait nearly doubles. So if you're someone who's relying on Medicaid or doesn't have insurance, you're waiting a whole lot longer for that first appointment. We do have, obviously when you start to talk about workforce, you talk about training people. And, if you have a shortage of dentists, you just make more dentists, which is much easier said than done. We've got 13 accredited dental hygiene programs and 3 full-time dental schools in the state. But with the numbers that are graduating, if you're putting out, say, 300 grads of each every year, but you have 500 people retiring, you're not actually solving the problem. So we know our numbers are not going to balance as much as we want them to. And so that's one of the reasons that we're kind of diving into that work. So we'll say, just a couple resources here, some new things that came out. We did publish our second workforce report in January, which kind of dove into some more of the numbers and gave a lot more perspective on sort of what the oral health workforce was looking like in our state. We have also, many of you who may be providers know that when you renew your dental license or dental hygiene license, that you actually do a survey with the Department of State, and they ask a whole lot of questions. And most providers say, I don't want to answer all these questions. I don't see the point. It doesn't make any sense to me. But what's really lovely is then we can put together a report and we can learn information about the status of our workforce, where it's heading, any changes over time, and then start to develop plans for improvement. So the Pennsylvania Department of Health was able to just last week release the report that was based on the 2021 license surveys. So that's linked there. You can go and check it out, see a lot of good information. There's demographic information. And so if you're wondering, hey, how many dentists in our state see kids at age 1? Well, you can go there and you can see that it's, 28%. And you can find that information out, which is really helpful in a variety of ways, especially for programming. Then the next thing on the list there, I'm really, really excited to tell you all about, and thanks to Allison here at PCOH for a lot of hard work on this. This is a project we started in the fall. We were actually able to present at the National Oral Health Conference about it in April, but we were able to build a dashboard on our website that provides sort of a graphic representation of a lot of these numbers. So I've talked a lot about these reports, the LBFC report, our workforce reports, the Department of Health reports. But, at the end of the day, that's like 500 pages of data. And I don't know about you guys, but that's kind of tough. Nobody really wants to read 500 pages of data. So we were really looking for a nice, easy way to show it in a way that's easy to access, go for the county you're looking for, the region you're looking for, just get the numbers you want for what year you want. And Allison was able to put together a wonderful dashboard that's now live on our website. It is in the process, I will say this week, we are currently adding in 2023 data. So it's a little wonky in some ways right now. So bear with us, give us about a week to get all the 23 data updated and set to be running correctly. But you can see there's numbers all the way back to 2015 on there. So you can actually go to your county and check sort of what your dentist numbers have looked like over time. So every 2 years, have you grown in dentists? Have you, lost dentists? It's a really, really great tool that I hope everyone here will use a lot. And our plan is to keep building that out, maybe add some additional dashboards in the future, and make sure that every 2 years when licenses renew, that we're updating that portal with the information. And then the last thing on this slide I just wanted to touch on is that we're also heading up a workforce community of practice right now. So working with the state partners you see there, we're looking at all the different aspects of workforce. So when we start talking about that, we start talking about non-dental workforce. We start talking about education, assistants, hygienists, dentists, programs when we're thinking about loan repayment options, number of schools in the state, just a number of things that all have to do with building up an adequate workforce. And that community of practice group that just started in the fall is going to be working on a number of priorities. So you'll be hearing a lot of information coming out around that. Now, I did, of course, when we talk about oral health workforce, I've got to mention our non-dental providers. Some of you may know that we have a position in the state since 2020, a certified community health worker, which is a non-clinical position that helps to connect people to care. So we're seeing a lot of hospitals and community-based organizations start to hire CHWs so that they can go out and say, oh, here are your healthcare needs. Here are the barriers you have to getting service for that. And here's how we can help. So we really want to make sure our community health workers are trained to talk about oral health, that they understand the importance of good regular dental care, and also that they have resources to point their clients to the right place. So we're doing an annual survey of those community health workers. We just through the PA certification board, which certifies them. We've got a continuing education course approved for credit. And then they're now holding an annual conference where we will exhibit and present. So really exciting stuff. For sort of a new part of the dental workforce. And then we continue to work with medical providers. Happy to provide more information, but of course our wonderful partner, the Pennsylvania chapter of the American Academy of Pediatrics, is doing a really cool project with a telehealth framework. So getting some oral health built in on the medical side, using a variety of online, social media, communications tools that are really amazing. And then we're watching very closely the addition of the silver diamine fluoride code on the medical side. So it's now a CPT code, and we're expecting sometime this summer that medical providers may want to start working and using silver diamine fluoride. So really, really important stuff. So the last main subject that I just want to touch on is looking at our state oral health plan and surveillance in the state. So, I think for those of you who've joined our calls before, we talk a lot about our state oral health plan. It is our guide. It's a 10-year plan and has a lot of aspirational goals. So why is it important? Of course, we've got to have our roadmap. We have to be able to know the direction we're heading and the subject areas that we want to focus on to make sure we're improving oral health. So a lot of information there. I'm not going to read all of that to you all, but the plan is available, easy to find. You'll be able to click the link and go right to it. There are a lot of pieces of the plan. Now, the description you see on the left is the things that are supposed to be included in a plan. I think our plan does a great job of those things. So curious to see what you think. If you haven't picked it up, it's a nice, easy document to look at and read, and hopefully you'll be able to kind of find your part in doing some of that work. So part of what PCOH does with the state oral health plan is that we serve as a contractor under the Department of Health and the oral health program, and we help them sort of keep an eye on how things are going and how we're measuring the progress that we're making under the plan. So I grabbed just a couple quick little points today just to show you guys, for the 10 years of the plan, we have some goals, but we're measuring things sort of as the data come in. So some goals we're able to measure annually, some we may only be able to measure every 5 years. But some of the successes we've seen so far, we've seen a decrease in adults who are, claiming incidents of tooth loss, which is really good. We want people to retain their dentition longer. We've seen a huge jump in the increase of school sealant programs, which is largely in part to the Department of Health and all of the work they do in this space. And then we've seen a slight increase in the number of general dentists that are accepting Medicaid. And that doesn't seem like much, 0.5%, but I can tell you as someone who's been watching the numbers since like 2011, that's the first increase I've seen. So really, really exciting to see. That was from 2019 to 2021. We saw that tiny little increase. So we'll be following closely the 2023 survey to find out if we've been able to maintain that. One other piece in terms of the state oral health plan, and one of the things that we're most proud of, I wanted to highlight today, was our basic screening survey. So for those of you Some of you may be familiar with this, but wanted to share this information with the idea that I'm going to share with you guys in this very secret way a little bit of the data that we're going to be reporting out. The State Department of Health is getting the report finalized. We're hoping it'll be released in the next month. So we'll be sharing that with all of our stakeholders. But for today, I wanted to give you guys just a little sneak peek because we're really, really proud of this project. It's a statewide tool that basically goes out and gets a representative sample of kids working with third graders. So we start with 80 schools, try to get into 80 elementary schools and see the entire third grade. Everything's done by passive consent. So if a parent does not physically send in a note saying their child should not be screened, we screen them. And it's a nationally recognized process. So this is something that many states do. Pennsylvania had not done a formal one pretty much ever. And we were able to use some of the CDC funding through the Department of Health to be able to implement this basic screening survey in the 21-22 school year. So very quick look in the mouths. It basically just measures for 4 indicators. So it's not an extensive screening tool. It's not going to give an individual child a personalized description of everything. What it is it tells us, do these kids have cavities? Do they have sealants? And how fast do they need to see a dentist? And so it's a snapshot. But it's the best thing we have, because prior to this, if you said how many kids have cavities in the state, you would say, I have no idea. Don't know how many kids have cavities in the state. Now we can actually answer that. So just a quick sneak peek, and I'm not expecting you to be able to see all these graphs and things on your screen, but we'll share some of the information, as I said, out later, and that report will be coming out. But during that school year, we were able to screen over 4,000 students, half of them low income, half of them not qualified as low income. We were able to make comparisons in their rates of decay based on urban or rural geography. And again, you'll get to see all of these things. There's not a ton to share there, but we were also able to break it down by race and ethnicity in the state. So interesting to be able to see who had the highest rate of caries, who has the highest rate of fillings, untreated decay, how urgent were those dental needs. You can see that really, really big discrepancy there. So every child, was marked as, early need, routine need, or urgent need. Urgent need meaning abscesses, infection, big problems. Look at the difference there between our Black communities and white communities, 33% to 5.5%. That is a huge discrepancy. So we never would have known any of this information without this basic screening survey. So really interesting. Also good to know right now that, our average rate of cavities in the state for kids is 60%. That's a lot. So definitely probably a little higher than we thought it was going to be. So something to pay attention to. And I'm really, really excited for you guys to see all of these data once we get the report out. So I'm going to move quickly through here so we make sure we have enough time. The last little piece on the basic screening survey I wanted to share with you all was the differences in high income versus low income kids. And I don't expect you to be able to read those charts super well, but as you might think, our rate of cavity experience for our high income kids was 52%. The rate for the low income kids was 68%. So significantly more cavities in those kids that come from lower income families. And so shows us a discrepancy that we've got to address. So definitely stay tuned. I know you're all going to love seeing those data and kind of working through all that. Hopefully in the next 2 weeks, 3 weeks, 4 weeks, we'll be able to get that full report out to everyone. And then the last 2 slides here, just wanted to share a few of the other things we're working on. Of course, we don't have time to go into everything that PCOH is working on, but we continue to promote our tobacco and nicotine cessation programming, which is a CE course for dental providers so that they can offer cessation counseling and feel comfortable doing so. We're hoping this year we're going to be able to adapt and publish a formal toolkit and making sure that as many dental providers as possible are billing for D1320, which is the code for tobacco and nicotine cessation counseling. I have to mention, I know we talked about some of the legislative pieces, but I also wanted to mention one additional memo when we talk about school health. Many are probably aware that we have mandated screenings in certain grades in our state. And some of our school districts have really struggled to be able to find dentists to come in and do that, especially when their offices are very backed up and they have wait lists. So a memo that's been circulating is to be able to allow those dental screenings to be performed by public health dental hygiene practitioners in the state, which are direct access hygienists. And so we're hopeful that that's going to see some traction this year. It's been introduced in the past. So, we really hope that folks can support that. The third thing on the list here, just a little bit about our HPV prevention protocols. Some of you probably received our dental provider toolkits last year. We sent a few hundred of those out and shared them at meetings and continue to do so. You're able to click the link there and you can request that we send you that if you haven't seen it yet, or download it. But what's really great is we had some funding to do that work last year, and we did see an increase in providers feeling more comfortable talking about HPV. So I think that that's something that is sort of a success for sure. Then the last sort of data slide here, just to share a little bit of information. We always say we have, nearly 1,000 individuals and organizations that are stakeholders in PCOH. But as you can see, these are numbers just for, this year. We've had almost 2,000 copies of our materials requested through our request materials page on our website. A lot of patient education materials there. We've got almost 1,500 Facebook followers. We do a ton of social media work, thanks to Amy. And then over 8,000 unique users to our website. So there's a lot of people looking at some of this information and being interested in oral health. So some really kind of cool total reach information there for us and sort of where we're going. And then lastly, I know I mentioned the summit, but wanted to make sure that everyone here had access to some of the links that you may need. We have a number of corporate sponsors and foundation sponsors that help support the summit. We want to make sure that anyone can attend that would like to attend. And we also want to make sure that folks are there to share information and resources. So we do have a sponsorship packet available at that link, and you're able to check that out if you know of an organization or a company that might be interested. There's a few open spots still available. And then we also, in 2021, started an awards ceremony at our summit, and really, really excited about that because so many of you are doing such good work and you don't always get recognized for it. So we want to make sure we get a lot of great nominations for some of the awards that are available. So there's a link there for that information. Just a few weeks till that deadline comes up. So make sure you get those nominations in very quickly. And we're also going to have an opportunity for some roundtables at the summit this year. So if you're working on a project or a program, or you're from an organization that intersects with oral health, and you want to submit a topic to talk about at the roundtables during the summit, please do that. Again, the deadline is just in a couple weeks, but we welcome as many as submissions as we can get there to make sure that we really offer all the best information to the attendees. So if you haven't marked your calendar yet, make sure you do. November 15th through 17th in Harrisburg. We're really, really excited about the event. Every year it's just gotten sort of bigger and bigger and more intense. It's a great way to really submerge yourself into sort of what's happening in oral health in Pennsylvania. And our focus this year is really on equity and how we can make sure that everyone has equitable access to oral health care. So there's going to be a lot of topics focused around those things. So I'm going to breathe for a second, check out some questions here, and apologies for not grabbing them sooner, but wanted to, keep talking so much. Just the first question I'm seeing come in a little bit around Medicaid, in terms of, how does that restoration bill end up relating to the approval of the state budget? Absolutely. It's interesting with bills because, you can get a bill passed, but you have to have money to actually fund what happens in it. And so what happens and what we know is that in order to restore the benefits, that we need approximately $74 million in the state budget. to cover those restored benefits. So, step one is getting the bill passed and seeing that the General Assembly appreciates that, and then also making sure that there's money in the budget to support it. So it is a two-part process. It doesn't ensure exact success just by getting that bill passed, but it's a good first step. And I will say, I didn't mention this, but we're also not working on this as a unilateral process. We're also talking with the Department of Human Services because they can elect to restore those benefits and put it into their own budget really at any time. So we want to make sure that we're leaning in legislatively and administratively to try and ensure that it will happen. So thanks for that question. And yes, definitely, I will get that. I see the comment about school screenings, and we can definitely do that for passive consent. And then when we see, let me see, dental screenings by our PhDHPs, we do struggle. And again, there's always a question about how we get dental into schools, and it could be a 3-hour long conversation. We know that we need more education in the schools. So yes, we want to make sure those dental screenings are able to be done by PhDHPs for districts that don't have a certified school dental hygienist, because many schools do not have one. The majority of schools do not. So we want to make sure that those PhDHPs can get in there and do the screenings. But yes, we also need more education. We were able to submit to the Department of Education this year some learning outcomes that focused around oral health, because what we would like to see is some more folks like school nurses and health teachers building oral health into their work as well. So, there's sort of a multi-pronged approach there as well. And then, yes, the Head Start forms and having PhDHPs sign those is always a really big problem. Unfortunately, that's because it's a federal regulation, it's really hard to make state progress on that. And what has to happen is that dental hygienists would have to be recognized as providers on the early periodic screening form. And so it's something that we haven't been able to make much progress on, but it's really never far from our thoughts. The one thing I will say is we've seen some success because of the use of teledentistry, so that if you have a dentist who works with a public health dental hygienist, and that public health dental hygienist is able to go to a Head Start location and do a screening there, but also be able to join by live video, that can then count as the exam if the dentist is on the other end. So that's been sort of a workaround in the Head Start piece, is we've been able to see that work through teledentistry. Doesn't always work for every situation, but it is an option. And especially now that the Medicaid programs are recognizing teledentistry as billable service. So definitely really, really important stuff. And thank you, Lindsay. Yes, certified school dental hygienists are what we love. We would love to see more than 27 districts in our state having certified school dental hygienists, because what you all do in terms of going in and doing clinical services and education and working with the kids and really helping them access dental care, at the end of the school day, is more valuable than any other kind of screening or process. So really, really would love to see that. And yes, definitely, we are, again, trying to increase certified school dental hygienists. That ends up kind of walking into a budget issue with each individual school district. So we have a number of resources that share how school health programs are important and what they can do. And we would love, if there are folks on the call who work with a school district and would like to get their school district budget to include a certified school dental hygienist, we'd love to work with you. We've seen that number. I think when I started 6 years ago, we had 36 districts, and then it went down to 30 districts, and then it went down to 28, and now it's at 27. And out of 500 districts in the state, 27 is not many. So would love to see a certified school dental hygienist in every district in the state. It would be the best thing that could possibly happen. So definitely working towards that, hoping that we can see those numbers go up. And if anyone has like a personal community campaign, we're happy to support that for sure. So any other questions? I know I went through those kind of quickly, but you all know you can reach out to us at any time. We're always happy to answer more questions, hop on a Zoom if you want to just chit chat and find out more details about some of the information we provided. We're here for you for that. And I'm not seeing any other questions come in. So I think we are all wound down for the day. We will go ahead and finish right on time. Hard to believe, but we hope to see you at some future webinars, and we will make sure to get all of this information out to you right away so that you can review the slides on your own, check out the links, and get back to us with any feedback or questions. Okay, everybody. Well, have a great weekend, and we will see you next time.